Morning, ladies and gentlemen. My name is Dustin LaPrey. I'm the Public Involvement Officer for the Division of Behavioral Health at the Department of Health and Welfare. I'm here to talk to you today about a desperate cry for increased funding for substance use disorder in the state of Idaho. We are currently unable to slow the growth of drug use in the state. As we desire more funding, the Idaho State Legislature is going the opposite direction and reducing our funding. In the state, we are currently down to 5 regional offices that only exist in the large hub cities. So if you live in any rural or frontier area of the state, you must drive miles and miles and miles to gain care, to reach a crisis center, or even a hospital in some situations. Alcohol is the most pervasive of all these offenders. It is available in state dispensaries and every corner mart in the state. It is the most used drug in the state. And yes, alcohol is a drug. Just because it is more acceptable, it does not make it less of a drug. It is a depressant, and it affects a large percentage of the people in the state. In Idaho, there's about 2 million people, and more than a third of them used alcohol this month. 300,000 of them engaged in binge drinking in the last month. The numbers are staggering, and it leads to death. Heart disease, car accidents, suicides, chronic liver disease, cirrhosis. Meth. You see this image here of a baby in the middle of the screen along with all these drugs, and you wonder, why is there a baby? And it's because that baby died of a meth overdose last year in Idaho. It is all over the place. It is in every community. And just because you don't see it doesn't mean it's not occurring. It is one of the most dangerous drugs on the planet. And even though it leads to these many causes and these different side effects that you'll notice on this page, all these random things like long periods without sleep. People just do not sleep. They pick at their skin. They are easily agitated and aggressive. That leads to crime. It leads to unsafe neighborhoods. And it leads to dangerous people who, while dangerous, are in effect innocent in their own right. For the last 25 years, doctors in Idaho have been able to prescribe opiates without any guardrails. 1 in every 20 Idahoans uses opiates. 1 in every 20. And when their prescriptions run out, citizens turn to street drugs like heroin and fentanyl. And that brings us to fentanyl. Fentanyl is the latest scourge in the drug crimes in America. It is leading the state in overdoses. It is 1,000 times more potent than heroin. It is tricked. If you see here, there's a box of pills. Those pills normally would be prescribed for someone who has pain tolerance, but fentanyl is so much stronger that the overdose rate is out of control. Somebody who, even a regular drug user who tries fentanyl for the first time, has a very high likelihood of overdosing on the drug. If you look at our stats here, you see that over 350 people died of overdoses last year in Idaho. That number should be much higher. There were 1,400 people whose lives were brought back because of naloxone and Narcan administered by regular citizens. 94% of all the recoveries of the people who were brought back to life were done by regular citizens, store owners, people in hospitals, but they were not first responders. They were not police officers. They were not emergency medical technicians. These are just regular people. We need to spread the options for these life-saving drugs across the state. We need more of them, not less of them. We need greater funding to purchase more of them and to make sure that it's available to more people across the state, because there's going to be times where you're going to be running your store, you're going to be working at an office somewhere, and you're going to walk outside and there's going to be someone who's dying in their car of fentanyl overdose, and you won't know what to do. We need to increase funding. We need to show people how to use this, because this is part of our life now. We can no longer close our eyes and pretend that this drug problem exists only on the West Coast in the major cities. It is obviously in Idaho very much very much in Idaho. And we need your help. We need increased funding. We need increased calls to action from citizens to talk to the representatives to help plead for the health and safety of their neighbors. These people are just people. They're your cousins and your neighbors and your friends, and they've been tricked at times by doctors who gave them dangerous drugs and then sent them home. They have been cast aside by society. Many of them are homeless. Many of them have opportunities or have had opportunities but have missed them. And we are not giving up on these people. At behavioral health, we don't give up on anyone. People recover from drugs all the time. It's something that happens. We have programs that help, but we need more of them. We need more satellite centers in every county seat in the state, not less. We need more children's crisis centers. There's only one children's crisis center operating in the whole state. There's plans to open 2 more, but there's no plans to build anything north of Boise. The entire regions of Idaho north of Boise, no plans to help children. We need more alcohol abatement programs in schools. We need options for Idahoans who were lied to about the effects of opiate use. And we need more crisis centers in more cities. We need smaller offices, and we need more money. Period. We need more money to be able to do this. And we need to convince the state legislature that it's worth it. So we're here to beg, and we're going to come around. We're going to go to town halls in every hub city and then every county seat in the state. We're going to meet with legislators and citizens to share our findings. And we're going to ask you to come out. And we're going to invite you to learn and to listen to us, and we're going to show you the real effects of this crisis, because it's not a foreign thing. It's not a distant thing. It's local now. It's our problem.